Welcome to our outpatient supplemental training video on medication administration. The purpose of this video is to complement the teaching you receive from your nurse and to act as a resource while you're at home. The topics we will cover are hand washing, safe preparation of the administration site, demonstration of a normal saline flush, medication administration, storage of supplies, proper documentation, appropriate IV site care, and how to recognize complications. If at any time you have questions, please refer to the OPT chart you were provided by a nurse and turn to the contact sheet for the appropriate health care professional needed. Thank you.
To begin, thoroughly wash your hands with soap and water for at least 20 seconds, ensuring to use good friction to clean between all fingers and the outside of both thumbs, between your palms and the backs of your hands. Then dry your hands well with a clean towel. Now it is time to safely prepare your administration area. When choosing an area to set up your supplies, ensure that it's an area that is away from traffic, dust, smoke, and pets. Using a clean cloth, wash the surface where you will be setting up your supplies. Once the surface is dry, place a clean towel on the surface. Gather your supplies from the storage area, which should be a clean space out of reach of children or pets, such as an upper cupboard or shelf. You will want to ensure that you have the following supplies: a garbage can and a clock or a watch, your medication, IV tubing, 2 saline flushes, alcohol swabs, and your OPT chart to document your medication administration. You will also want to ensure that you have something to hang the medication on at least 3 feet above you. This could be a lamp, a picture hanger, or anything else that is secure and will hold the bag. Before proceeding, ensure that the label on the medication has your name with the right drug and the right directions. Begin by opening the IV tubing package. If it does not open easily, open the package from the opposite side. Remove the tubing from the package. Remove the paper tape. Unwind the tubing. Close the roller clamp. And set the tubing on your clean surface. Let's take a moment to go over the parts of the IV tubing. At the top, you will see the spike end. Below that is the drip chamber. You will then find the dark blue pinch-off clamp. And below that, you will find the roller clamp. Ensure the roller clamp is closed. At the other end is the light blue cap. This is the end that you will connect to your IV. Do not remove the cap at this time. Open both of the saline flush packages and place them on your clean surface. To prepare the syringes, place the syringe in your non-dominant hand and use your dominant hand to remove the cap. Gently pull down on the plunger to break the seal. You will feel resistance. Continue to gently pull down the plunger until you feel the resistance release. Once the seal is broken, slowly push the plunger up to expel the air. You should see fluid at the tip of the plunger. You may then place the syringe on your clean surface. Repeat this procedure with the second syringe and replace the cap. To prepare your site, pull your protective sleeve up to your shoulder and unroll your extension line. Refer to your purple pamphlet called How to Care for Your Peripherally Inserted Central Catheter and look at your daily checklist to perform an assessment of your IV site. If there are no concerns, then proceed to the next step. If you do have concerns about your IV site, please refer to your OPT chart to find the appropriate contact information. Hold the end of your infusion device between your thumb and forefinger of your non-dominant hand. Using your dominant hand, clean the end of your infusion device with an alcohol swab for 10 seconds, using good friction around the sides and the top. If at any time you accidentally touch the end of your infusion device or the end of the syringe, clean the area with an alcohol swab before proceeding. With your dominant hand, firmly push the tip of the syringe into the end of the PICC line valve and turn the syringe in a clockwise motion until the connection is tight. Inject the 10 milliliters of saline using a push-pause method. If you meet resistance, reposition your arm and reattempt. If resistance is still met, or you experience pain, swelling, or leakage at the IV site, stop, disconnect, and refer to your OPT chart for the appropriate contact number. After you have administered the saline, disconnect the syringe by turning it in a counterclockwise motion. Discard the syringe into the garbage. Place the mini bag in your non-dominant hand and remove the blue plastic cap and discard it. With your dominant hand, pick up the spike end of the tubing and hold it between the fingers of your non-dominant hand and remove the protective cap from the spike. Transfer the tubing back to your dominant hand, taking care not to touch the spike end. Hold the end of the mini bag firmly and insert the spike using a twist and push motion. If at any time during this process you touch the end of the spike or the bag, use an alcohol swab to clean this area for 10 seconds prior to continuing. Hang the medication bag approximately 3 feet above your head on a secure device. Squeeze and release the drip chamber until it is approximately half full of fluid. If the fluid does not enter the drip chamber, try advancing the spike further into the bag. Slowly open the roller clamp so that the fluid begins to fill the tubing. Allow the medication to completely fill the tubing. Once full, you will see drops of the medication come out around the blue cap on the end of the tubing. Close the roller clamp. Ensure the line is clear and set it on your clean surface area. Hold the end of your infusion device with your non-dominant hand and clean it with an alcohol swab for 10 seconds, ensuring to thoroughly clean the sides and the top. Pick up the tubing with your dominant hand and remove the blue cap, ensuring not to touch the end. If you do, clean it with an alcohol swab. Using your dominant hand, firmly push the end of the tubing into the end of your PICC line valve while turning in a clockwise motion until secure. Slowly open the roller clamp on the tubing and set the drip rate according to the instructions specific to your medication as documented on your drug sheet in your OPT chart. Allow the medication to infuse over the appropriate period of time. Once the medication has finished infusing, there will still be fluid in the tubing and the drip chamber should remain half full. This is to be expected. Slide the dark blue pinch-off clamp on the tubing to stop the infusion. Using your thumb and forefinger of your non-dominant hand, firmly hold the PICC line valve of your infusion device. Using your dominant hand, remove the tubing from your infusion device using a counterclockwise motion and pull straight out. Replace the light blue cap onto the end of the tubing by pulling down and pushing firmly. You will now need to administer your second saline flush using the same method as the first flush. Once the saline flush has been completed, neatly coil your extension tubing on your arm, ensuring there are no kinks. Secure the tubing by replacing the protective sleeve. After your medication administration, be sure to document it in your OPT chart on the notes page. Discard your used supplies and return your remaining unused supplies to a clean, safe location out of reach of children and pets.
In closing, thank you for taking the time to watch our video, and we hope you have found it helpful in administering your medications at home. If you have any questions at any time regarding your IV site or your medication, please refer to the contact list in your OPT chart.